or pretend not to get it will get with the program.
Cracking down on people who aren't following the rules, the City of Toronto brings in a new bylaw to go after those who aren't properly practicing physical distancing. Good evening, I'm Dwight Drummond. Welcome to viewers in Windsor and to those right across the GTA. We begin tonight with the situation in Toronto area long-term care homes. The numbers of deaths continues to rise today. More outbreaks are being reported, including at a Scarborough nursing home near Nielsen and Morningside. Lisa Shing speaks to the worried son of a resident who has been diagnosed with COVID-19.
It wasn't that long ago that Sal Morana and his father Salvatore were able to share moments like this, even after the 92-year-old moved into Seven Oaks long-term care home in Scarborough.
We're just maybe a call away from the worst case scenario.
After non-essential visitors were banned, the family was still able to see Salvatore using FaceTime. This was the last time before his dad came down with a fever on Sunday. Just yesterday, Morana found out his father tested positive for the virus.
We're still devastated. We feel helpless. The whole family's devastated. We're all in lockdown mode. I'm very sad that we just can't be with him.
That feeling isn't helped by the fact that 8 residents at the home have died as a result of COVID-19. 9 staff members have also tested positive. And this morning, news that 3 residents of St. Clair O'Connor Community Long-Term Care have also died. 13 are showing symptoms. The home only has 25 people living there.
It's a very large portion of our population in nursing home, and we are preparing for it to sweep right through the nursing home. It's extremely upsetting in terms of the fear that you would have for the residents that you're looking after. They're frail. You've known them for a very long time. You know their families very well, and you know COVID-19 is mean.
Toronto Public Health says it's doing everything it can to protect the most vulnerable.
Everything from active screening, enhanced cleaning, isolation of residents as soon as symptoms are identified.
Experts are warning the number of outbreaks in long-term care homes will continue to grow, especially if medical officials don't recommend that more widespread testing be done, including all residents of a long-term care home, even if they don't have symptoms. Lisa Shing, CBC News, Toronto.
There have been 2 more deaths as a result of COVID-19 at the Pinecrest nursing home in Bobcaygeon. The 2 residents died overnight. In total, 16 residents and the wife of a resident who was also a volunteer at the home have passed away in just over a week. It is the question many people are asking: how bad could this coronavirus outbreak get? Well, Ontarians will get an idea tomorrow, and Premier Ford is warning us it will be hard to hear.
I've asked our medical experts to provide a full briefing to the public on where this could go. It's going to be stark, as I mentioned. That will be a real wake-up call to folks that we don't want to see the beaches and the parks packed. We're going to tell people exactly what we know. The figures I see, you're going to see the exact same figures and the same modeling that we've seen. I can't sleep at nights thinking I have something and I'm not being transparent. I can't do that to people. I just got to be upfront with them and tell them exactly the figures. I have confidence and faith in the people of Ontario.
Now, Ontario would be among the first Canadian provinces to release their modelling data, but Doug Ford says he's not breaking ranks with his fellow premiers or the Prime Minister, who even today was reluctant to disclose the numbers he's seeing. Here's what Justin Trudeau had to say.
People want to know what the model is, how long they're likely to be in this situation, when kids can see their friends again, when we're going to be through this phase and get back to work. Those analyses depend directly on Canadians' behaviors. I think people can imagine a range of scenarios that shows everything from everyone gets suddenly better within the next few weeks to this situation just keeps getting worse and we face a situation like some other countries in the most dire situations have. There is a range out there, and just highlighting that range is not as useful or important as being able to get clearer numbers and clearer analysis of what we are likely to face.
While we wait for those numbers, here's one for you. 1 in 10 of known COVID-19 cases in Ontario are now healthcare workers. That's about 230 cases. That means there are fewer frontline healthcare workers on the job as hospitals gear up for a surge of patients. Lauren Pelly has more.
While hospitals across Ontario are caring for hundreds of COVID-19 patients, new numbers show healthcare workers are also falling ill. The provincial data provided to CBC News shows at least 229 positive cases among physicians, nurses, and other professions. Local public health units in Ottawa, Toronto, York Region, Peel Region, Waterloo, and Windsor are reporting some of the largest numbers. Most of those cases were tied to travel, not patient care. But there is growing concern about more healthcare workers being exposed in a clinical setting, with a surge of COVID-19 patients expected in hospitals in the weeks ahead. And it's all coming against the backdrop of worries over rationing and shortages of personal protective equipment. This week, nursing staff at the Hospital for Sick Children say a memo was sent to workers on the transplant unit, calling on nurses to use only 2 surgical masks each shift and suggesting there is already a shortage of full face shields. The hospital told us it implemented limits on mask usage after getting new guidance from the Ministry of Health and is conserving equipment because the overall global supply is constrained. Provincial officials say more supplies are in the pipeline.
Well, I think the most important thing first is that we make sure that all frontline healthcare workers in hospitals, home care, and long-term care have the personal protective equipment that they need to.
It would be fair to say that most emergency physicians and nurses are anxious about adequate protection equipment, and we hope that these promises materialize into actually cartons of stuff arriving at our doors.
Until those arrive, healthcare workers will likely stay worried about the safety of their patients and themselves. Lauren Pelly, CBC News, Toronto.
Canada's chief science advisor says Ontario needs to be doing more testing for COVID-19.
I have to say that I am a little bit preoccupied by the situation in Ontario, because we should be doing more testing in Ontario, and I hope that they're going to be able to ramp this up.
Ontario has tested nearly 63,000 people for the disease, but there's currently a backlog of more than 2,000 tests. Epidemiologists say widespread testing is an important component of the fight against COVID-19 and accurately tracking the spread of the virus. The province's Associate Medical Officer of Health says the testing focus remains on certain people.
I think it's important to focus still on people who are symptomatic or who have been contacts who develop symptoms. And there are certainly people who are fit those categories that are not being tested at this point. So I think that those would be the groups.
Provincial health officials said last week that Ontario hopes to be up to nearly 19,000 tests a day by April 17th. Changes are coming to how busy TTC buses can get, but it's not an official TTC policy. The union representing TTC workers has told its bus drivers to limit the number of passengers to 10 riders on a regular bus and 15 riders on those longer so-called bendy buses. ATU Local 113 says they made that decision after seeing overcrowding on buses recently.
You can't sit around waiting for the TTC to decide when they're going to do it or when they're going to implement it. We're being proactive. This is a health and safety issue.
We haven't gone with a maximum limit of customers on a bus because we want our operators to focus on the driving, which is incredibly complicated, and focus on safety rather than on counting heads.
The TTC also says 15 routes are getting more vehicles to address crowding. 18 TTC Wheel-Trans drivers have volunteered to bring potential COVID-19 patients to assessment centers during the pandemic. Now, the TTC is offering the service to its regular Wheel-Trans customers. We went along with one of the drivers today to see how the service works.
As soon as they said they needed help, it was, to me, it was a no-brainer. I'm here to help, and with everything that's going on, why not?
asked by the Office of Emergency Management to take part in helping out with special transport during this COVID-19 situation here in the City of Toronto. So we've been asked to train some of our operators, and they've been specially trained by EMS to be able to take some transports. And these are customers, citizens of Toronto who may be vulnerable and require transport from a location, a shelter location, or some other location in the City of Toronto to an assessment site to be assessed, and then possibly taken back and tested, and then taken back to their location. We really help to make Toronto move, and we know that people still need to get tested, people still need to get around, and just because they're being tested for COVID doesn't mean that they shouldn't have an opportunity to do that.
Actually, people are sort of excited in a way to help. The 18 people that have been trained for this, that I have talked to, are same as me, just wanting to help to stop the spread of this COVID-19.
There are now 125 confirmed COVID-19 cases in Windsor. This as 3 long-term care homes in the area deal with a coronavirus outbreak. CBC Windsor host Chris Ensing joins us now with more on these outbreaks. Chris.
Yes, Dwight, the number of cases there, our medical officer of health is saying that those are primarily the big jump happening because of that backlog in testing. London has set up a site now and we're seeing results coming back quicker, but it does show that numbers have nearly doubled every 48 hours this week. That primary concern, though, continues to be the long-term care facilities. Our Jason Vio has this for you.
This morning, health officials confirm another seniors home in our region hit with COVID-19. A staff member inside of this building here, Lifetimes on Riverside, has tested positive, and residents inside are also being tested for the coronavirus.
Typically, what happens in a home, if we know that there is a respiratory symptoms or someone who has an infection, the likelihood of others contracting it is much higher than in the community. All those controlled measures that we are trying to put is to ensure that we can contain it.
The health unit issued a clear directive this morning. Those working in long-term care homes with outbreaks should not also be working at other facilities. Now, just yesterday, 2 more confirmed cases among staff members at Country Village Homes in Woodsley, that's just outside of Windsor. And the health unit also says 1 staff member at Amica Riverside Seniors Home has tested positive for COVID-19, but a spokesperson for the residence says someone who lives there also has the virus. They say that resident is currently in hospital, and before that they were self-isolating in their unit. And some senior residents in Kingsville at a home there where there isn't an outbreak say they feel isolated in their rooms. That's where they get their meals delivered 3 times a day. Someone checks their temperature, but they can't leave. New directives from the Ministry of Health say that even 1 lab-confirmed case of COVID-19 is now considered an outbreak for a facility. The health unit says these homes have appropriate outbreak management protocols and continue to wear personal protective equipment. Jason Vio, CBC News, Windsor.
Now, here in Southwestern Ontario, there's been close attention paid to what's happening at a seniors home in Sarnia. 4 people have died because of COVID-19. And one of them was Charlotte Jones. She was 88 years old. We have a photo here of her celebrating her birthday with her family. And her daughter Bev spoke with us today saying that Jones was witty, spry, happy. And you can see that there. They told us that they want to give their family members a big hug, but can't because of the physical distancing requirements. Now, her daughter and son will bury Jones alone tomorrow, the final line in her obituary. Due to the current health crisis, Charlotte's final wishes were to protect her family and have a private interment to avoid any risks of exposure. It's just another example of not only how this virus has changed the way that we live, but it's also changed the way that we honor those who have died. Dwight?
It really has, Chris. Thank you for that.
Social isolation can be hard on people. And my message to everyone watching today is this: you're not alone. We're listening. We care.
The mental toll of isolation. Details on the Ontario government's plan to help people deal with the pandemic mentally coming up next. The head of the Ontario Council of Hospital Unions is upset about a new Ontario government policy for frontline healthcare workers. Michael Hurley says the policy gives some workers access to protective equipment while excluding others.
97% of our members said that they feel abandoned by the provincial government. 87% of them report shortages of personal protective equipment. And in some long-term care facilities, the equipment runs out in a day or two, and we haven't even felt yet the full extent of this virus.
Hurley says they are being told more equipment is coming, but it never arrives. They are asking that masks stockpiled by Ontario after SARS be released to healthcare workers. They also want the government to direct industry to ramp up protection of personal protective equipment. Earlier today, the Prime Minister said 11 million more masks have arrived in Canada over the past 2 days. As we told you earlier, the Premier says the projections of COVID-19 in the province are a wake-up call. The details to be released tomorrow are stark. This comes as some people are already struggling with their mental health during this crisis. Today, the Ontario government announced it is spending $12 million for extra mental health supplies. Lorenda Redekop has that story.
We know this is very, very stressful, and we want to help.
The Premier acknowledged he knows physical distancing is hard. The province a different place under the reality of COVID-19. Today, he announced $12 million for mental health supports. Free help will be available virtually, online or on the phone, to assist with issues such as increased stress and anxiety. The Premier had this message for people.
You're not alone. We're listening. We care. If you're struggling, please reach out. Talk to someone. If you know someone who may be struggling, talk to them. Pick up the phone. During these difficult days, we all need to stick together.
People aren't sleeping well, people maybe not be eating or overeating, they're getting irritable and grumpy. These are all the signs of, increasing levels of anxiety and stress.
Some of the $12 million will go to the Canadian Mental Health Association for a program called Bounce Back, over the phone in close to 20 languages.
Actually supports people on how to manage that low mood, stress, anxiety, depression, worry. Everything from, you're not sleeping well, all the way to, I need to figure out how to manage my mood. I feel like I'm irritable, or I need to feel happier right away.
It's available to anyone 15 and up, though not meant for people in a state of crisis. But on the streets today, it's clear many people still aren't following recommendations to stay home as much as possible. The Premier and Health Minister said while they know it's difficult, it's crucial to help prevent the spread of the virus. Lorenda Redekop, CBC News, Toronto.
If anyone is still clinging to the idea that youth is a natural defense to COVID-19, consider this. About half of all cases are now people under 50. Wikidopia takes a look at the changing demographics.
Every day it's a challenge.
Rene Segura landed in the ER after difficulty breathing. His condition worsened, so he was put on a ventilator, just like another patient in the ICU with COVID-19.
Unfortunately, he didn't make it. And I guess that's when reality hit, that there's a chance I may not make it home.
Segura is now recovering at home. Before this, the 41-year-old was otherwise healthy. His age group, people in their 40s and 50s, make up more than a third of diagnosed cases in Canada, followed closely by younger adults. And of those sent to hospital, about 1 in 8 are under 40.
So it means that we're all susceptible.
This U.S. researcher is looking at factors behind the differences in the spread of infections.
We have U.S. and Canadian kids going down to Florida and crowding on the beaches.
And that crowding continues today, at least at this popular park, which is supposed to be closed. The idea that younger people are somehow unaffected persists. Epidemiologists say they can spread the illness to others, yet that message may have been overshadowed by the fact that it's still the elderly most at risk.
I believe many people in my profession, myself included, have dropped the ball a little bit on how best to communicate risk, outcome, and relative importance of this moment in history.
That risk and where we are in this outbreak will be determined by the precautions we take or don't take, no matter the age. Vic Adopia, CBC News, Toronto.
If there was any remaining doubt about the widespread economic toll on individuals during this pandemic, well, today they were completely swept away when new U.S. unemployment numbers were released. Numbers that are staggering.
I don't think people realize how many of us there actually are out there.
With stores and businesses closed in much of the U.S., 6.6 million Americans filed jobless claims in the past week. It's a dramatic record high, double the record set just a week ago, and even worse than economists expected. It means in the past 2 weeks alone, close to 10 million Americans have filed for unemployment benefits, and even more expected to join their ranks as more states order lockdowns. Ottawa's multi-billion-dollar emergency response benefit programs are aimed at helping Canadians and businesses financially for a 4-month period. The Trudeau government was asked today what happens if this pandemic continues after that.
We will do whatever it takes for however long it takes. These economic measures are huge, and we are going to be there for them for however long we need to before the Canadian economy, until the crisis ends, and it will.
After the break, today's Frontline Hero. You'll want to stick around for that. We'll be right back. Today, we are honoring a calm and passionate operating room nurse as part of our Frontline Heroes series. Each day, we introduce you to a new face fighting the COVID-19 pandemic head-on. This is Kelly Viron. She's a scrub nurse at Hamilton Health Sciences, and to her friends and family, a hero. Her friend Kimberly Schmaltz wrote this to us saying, Kelly has gone into work with the same passion she always has, if not more, not letting fear of this pandemic impact her role. When she's not working, she is an advocate to everyone in her life, whether it's through group messages or individual calls. She is keeping us all informed and safe. Thank you for doing that, Kelly. Thank you for joining us. If you would like to share a story about your frontline hero, send us a selfie-style video explaining why they are a hero to you. Just email us at torontotips@cbc.ca, tag us on Twitter or Instagram at CBC Toronto, or just send us a message on Facebook. There are a lot of heroes out there that we would love to help you recognize. That is our show for tonight. Thank you for joining us. Power and Politics is coming your way next.